You'll just have to describe your emotional state to us.
Okay,
since we can't see you.
All right. Well, sorry about that, Kimberly, that you had difficulty getting on. We're learning as we go here at the ACLU for these things, but let's see.
Thank you for your persistence,
yes,
Kimberly.
we appreciate that.
I saw like a few people RSVP'd right before 4. Are they going to get the link?
It should have been in the attendee information, but once we get started, I can resend the link really quick. Okay, so do you want to go ahead and get started?
Yeah, let's do it.
Okay.
All right, so Denise
I think that cues it up to me. So I am going to, first of all, say good evening. And thank you to certainly our panelists for being here, but to the great number of participants that we have. We thank you for joining this webinar, and the theme of which is redemption is real and clemency is compassion. On March 6th, Colorado confirmed its first COVID-19 case. And since that time, Governor Polis has issued multiple, indeed hundreds, of executive orders and has asked all Coloradans to do their part. But here's a fact, and one that may not be very well or fully known, and that is the COVID-19 virus is rising in Colorado prisons. And because Colorado, like all other states in the nation, disproportionately incarcerate Black, Brown, and Indigenous people, they will suffer the most from this rise. Governor Polis has the single most authority to protect people in prison from this virus. And we are asking him to do his part. And he can do his part to protect these individuals in our institutions, our prison institutions, by releasing elderly individuals, those who are ill, have underlying health conditions that make them susceptible to the virus, and of course, that present no safety risk to the public. So this evening's webinar is really a prelude to what we hope you will all help us with tomorrow, and that is our day of action. So tomorrow, Thursday, August 27th, is our Decarceration Day of Action. The ACLU, along with 50 other nonprofits, and hopefully you, are going to join together for a Decarceration Day, and we are going to urge the governor to do his part to safely release vulnerable incarcerated people. Here's what we're asking. Email the governor, call the governor, contact the governor, tag him on all of your social media posts, and tell him that he needs to do his part to release these individuals. When criminal justice reform groups, including the ACLU, has confronted the governor on this issue, he hides behind one single talking point. I'm not going to release dangerous people from prison. We're not asking him to. We're asking him to release individuals who clearly present no safety risk at all. And we know there are people in those prisons behind those walls that should be released. You will get an email after this webinar that'll give you all of the information you need to know about how to participate in this day of action. You'll get the email, you'll get the phone number, and you'll get some social media tips, some ideas on how you can post this on all of your social media. So that is tomorrow, day of action. Please join us. We want this governor to feel the pressure and take some definitive action. Before I turn it over to the panelists, we do want to show you a very, very short video. It is a video of Anthony Martinez. He is an 84-year-old who has spent 30 years incarcerated for a series of robberies, but he spends each day in a wheelchair in his cell in Sterling, which, by the way, the Sterling Correctional Facility now is the it is the facility in Colorado that has the highest number of COVID-19 outbreaks. He's terrified of catching COVID, so he simply stays in his cell. You can see his quote here that he frankly fears the way that the COVID-19 virus has ravaged through the facility. And for him, this can be a potential death sentence. In the picture here is Kelly Bracer. It is Anthony Martinez's niece, who would love for him to come home and have him spend his last years with her. Kelly is not on our panel, but I understand she's in the audience this evening. And I want to say thank you to her for lending her voice and her story to make this video really powerful and to make our day of action tomorrow as well very meaningful. I want to give a really, really important shout out to Progress Now Colorado, PNC Colorado. They produced, directed, edited, and did this video, and they did one heck of a job. So I really do want to thank them. And after the video, you'll hear from Helen Griffiths, our public policy associate. She will be the moderator of the panel and take the program from there. Now the program is from 4 to 5, it's an hour, but please stay on if you have questions that you want to ask the panelists, because they're going to stick around after 5. Thank you so much. Enjoy the evening. Really appreciate your time. And always remember that redemption is real and clemency is compassion. Let's go with the video. Thank you.
I feel that the staff has been negligent in its duty to keep us in a safe environment, constantly moving us multiple times into housing areas with people whose roommates just tested positive, and without proper sanitation of the cell or quarantine of the exposed.
Selena, can you pause the video? We're not seeing it.
I apologize. I will figure out what's going on really quickly. I had it working perfectly in the run through. How did that?
Worries. And thank you everyone for your patience. We normally do these events in person, but I'm sure Delina will get it up on the screen.
I will. Just 1 second.
Perfect. I can see it.
All right. Yep. We will restart the video, and I apologize.
I feel that the staff has been negligent in its duty to keep us in a safe environment, constantly moving us multiple times into housing areas with people whose roommates just tested positive, and without proper sanitation of the cell or quarantine of the exposed inmate. For me, this can be a potential death sentence at my age of 84.
My name is Kelly Brazier. My uncle, Anthony Martinez, he's been incarcerated for nearly 40 years. He has underlying health issues, and my uncle is one of 9 people in his entire wing that does not have the coronavirus.
My name is Denise Maes, and I'm the Public Policy Director for the ACLU Colorado. We try to advocate to do things that advance civil liberties. And the whole point of this advocacy is to try to decarcerate Colorado prisons. Epidemiologists all over the country have concluded that prisons are really a petri dish for the virus. There is no way in a prison that you can follow any of the CDC guidelines. There is no 6 feet distancing. The fact of the matter is there are 2, sometimes 3 individuals in one cell.
Not to mention the fact that he has kidney issues, renal failure. His drawings over the past 6 years declined. He has to have somebody else write letters for him. It seems like his activities, like going to Sweat Lodge and making things, has deteriorated along with his health.
And for someone like Mr. Martinez, who waited a couple of years to get his wheelchair, prisons are not nursing homes. They're not hospitals at all, and yet they're being asked to treat some of the inmates in a way that's really impossible.
This coronavirus has been hard because I don't get the 1 to 2 letters a month like I used to. And that increases the anxiety, that increases the worry. From everything that I've read, he deserves a second look at his sentence. I think that he's served his time. His parole date's not till 2026. 2026, he will be 90 years old. That's if he survives that long.
In Colorado, we have a strange system, and a lot of other states have it too. It's called a habitual offender law, which means is if you commit that crime more than once, your sentence escalates accordingly. For example, an individual who commits a homicide can get a 10-year sentence, but someone who commits a robbery for the third time is in there for 36 years. The other fact about Colorado prisons, there's a large percentage of our inmates there that are 60 and older. Only 1% of crimes are committed by individuals over 60. Now, there is no data to say what percentage of crimes are committed by 80-year-olds, because I'm sure it is practically, if not in fact, zero. Mr. Martinez is 84 years old. He's been in prison for a couple of robberies for nonviolent crimes. So I can say to Governor Polis and to anybody else who will listen that Mr. Martinez, at the age of 84, presents zero public safety risk for anyone.
I feel that he should be able to come home. He should be able to live the remainder of his years out here, whether it be 1 year or 10 years. I think there should be some mercy.
Here in the United States, we forget the real ability and the real power of redemption. And that's not just Mr. Martinez. There are a whole slew of individuals, young and old, where redemption is really possible if we just give them a chance. We are completely out of step with all other Western democracies. We incarcerate more people per capita than any other democracy in the world. So let's not turn our back on individuals like Mr. Martinez. He is an individual that I think underscores the exact type of person who should be granted clemency and released from a Colorado prison. There is a clemency petition in front of the governor, and so the governor could grant him clemency at any time. Colorado just repealed its death penalty, and yet we are inevitably sentencing a lot of individuals like Mr. Martinez to death, and that punishment clearly does not fit his crime.
Okay. Thank you so much again to Progress Now Colorado and to Kelly for sharing your stories and for making this video possible. So the goal of this webinar is to start to have a conversation about releasing people from prison, which I know is a conversation that some people haven't had and that to some people can sound scary. And frankly, Governor Polis has fed into this sense of fear by saying that he won't release dangerous criminals, which makes it sound like it's a public safety risk to release people from prison. But Colorado as a state incarcerates more people than most entire Western democracies as countries. And it's clear we can safely release people. And I'm really excited to have these panelists so that we can have this conversation about decarceration and the legacy of mass incarceration, which has divided families, deepened racial injustices, and left us this legacy where there's so many medically vulnerable and older people in our prisons. So COVID-19 has just shed a light on something that we've known for a long time, which is that our prisons don't work. So our first three panelists, Amber, Will, and Sandra, all have loved ones who are behind bars right now. Amber Johnson's 62-year-old father, Ronald Johnson, has turned his life around in prison after being convicted of nonviolent offenses related to substance abuse. Will Cranfill's father, James, is a 62-year-old grandfather, artist, and Navy veteran who suffers from chronic inflammatory lung disease, a condition that puts him at grave risk of COVID-19. Sandy Wilson, whose husband Gary is a 58-year-old grandfather with severe respiratory problems, is serving a 1-year sentence for drug possession in Sterling, the site of Colorado's largest COVID-19 outbreak. Our next 3 panelists all have devoted their professional lives to advocating on behalf of people behind bars. Hassan Latif is the executive director and founder of the Second Chance Center, where he works to assist formerly incarcerated people reestablish their lives and become successful members of our communities. Erica Grossman is a partner in the law firm of Holland, Edwards, and Grossman, and our cooperating counsel in our lawsuit against the Colorado Department of Corrections and the governor. Gail Johnson has spent more than 20 decades representing clients in criminal and civil cases in federal and state courts in Colorado, California, and the District of Columbia. So we're going to start by asking our first question to Sandy. So Sandy, I know that for years and years, so many nonprofits, organizers, and family members have been working to release people behind bars, and this pandemic has given us a new sense of urgency in this work. I know we spoke and you talked about how much you worry about Gary every day and how you've had to postpone surgery for your cancer because he's behind bars. Can you talk about how it feels to have your husband incarcerated during this pandemic? And here is a photo of him since he can't be with us in person.
I know. As long as my husband's stuck in there, I feel like I'm stuck there with him. I'm paying every day. I'm doing a sentence right along with him because I'm denied to be with my husband, and it's the not knowing that he could die without me touching him, seeing him, or looking in his eyes. And with him home, I know he'll look at me, and it's the look of everything will be okay. And you can't even visit up there now. And he's my heart, and I can't move on in life knowing I may never look in his eyes again or feel him, and know that everything will be all right. At our age, and with his illness and mine, some days he can't even move. And I just want that last, you're not being rehabilitated, you're stuck there. His sentence is so short, he's not eligible for any programs that are in there. And with the virus, they're stuck in their cell all the time, and they have nothing for schools. How is that? Our system needs to rebuild it and look at it. The nonviolent criminals need programs or special help. How are you helping them in there? How is he being rehabilitated? Even if he could work, what, doing dishes is going to rehabilitate you? He puts a sick call in, and they're nurse practitioners. They tell him, well, we can't do anything. You need a doctor, and you got to be sent to Denver for that. So you know, it's just tough luck. And they have no respiratory help there at all. They have no respirators there, nothing. If an inmate gets sick, he gets put in segregation with nothing but his boxers. They take all his possessions away. So you're in there 24/7 with nothing. Can you imagine that? And just have a guard and a nurse come around and take your temperature and give you no medical needs? If that happens to my husband, with him already on arrest, breathing with air, he'll not make it a week. And I feel the system needs to rebuild it. It needs redone. These people that are in here are from way back when it was, you know, you're going to jail, you're not getting out, you're a drug user, you're a drug dealer. They need to change it. We have rapists, we have murderers out there, we have crimes that are unimaginable done to people, and their time is so short. And they're putting our loved ones in there that are addicts, shoplifters, minor things, nonviolent. They're doing more time than them.
Yeah, thank you, Sandy, so much for sharing. And I know that we've talked about how hard it is to not be with him, and you know, take a deep breath. Thank you so much for sharing. I know it's really hard. And it really struck me when you said, as long as he's stuck in there, I feel like I'm stuck in there with him. And I think too often, you know, we forget about all the people who are hurt when we put someone in prison for a really long time. So my next question I wanted to ask to Amber. So if we can get Amber on. Hey, Amber. So I know that, Delina, thank you. So I know, Amber, your dad has spent 22 years in prison, so you've missed out on 2 decades with your dad. And something that we talk a lot about at the ACLU is the idea that redemption is real and that people are more than the worst thing they've done. So can you talk a little bit about why you think that people like your dad and other people behind bars who've worked really hard to become better people and devote themselves to change, why should they get a second chance at building a better life behind prison walls? And I just want to bring up these photos of Amber's dad as she's talking.
Well, it's a great question. Helen, my dad, I think is a shining example of a person who's behind bars who deserves a second chance because he has put in a significant amount of work, and he really is a remarkable man. He has served 22 years of a 96-year sentence. So I can't even imagine what it's like to be incarcerated, faced with that type of time, and particularly for a nonviolent crime. One of the things that I'm most impressed about what he's done is that he's gotten sober. He was a drug addict, and his desperation to continue to get his drug is really what fueled the offenses that ended up getting him in prison. And behind bars, you don't have to get sober. So he has taken the initiative. He's had the strength and the courage to get sober, and he has the integrity to have remained that sober for about 15 years now. And I just think that that's incredible. That's amazing to get sober when you're faced with that type of devastating sentence. Has also received job training and worked usually multiple jobs for most of the time that he's been incarcerated. And he's received outstanding performance reviews for his work. He's been active in church. He's participated in mental health counseling and also organizing mental health programs for other incarcerated individuals so that they could all benefit from the mental health treatment. He's mentored and tutored other inmates who were working on towards their GED. He's been in the incentive unit for the entire time that it's been available. And he's also just received the support of so much of the staff from the Department of Corrections, the staff, the chaplain, warden, case managers have all written letters and advocated on his behalf to get him home. One of them even said that they would love to have them as his next door neighbor when he comes home. So he's done as much work as he can on himself and to build the inmate community while he's been incarcerated. There's no more need for him to be incarcerated. He's paid and served his time. It's time for him to come home and be with his family and to be a benefit and high contributing member of the community.
Thank you so much, Amber. You are an amazing advocate for your dad, and you're lucky to have each other. I wanted to read out part of a letter that Ron wrote because it just really struck me. He said, "As I've grown and looked into myself, I've come to take responsibility for the choices I made. And when I accepted the harm my role caused others, I actively sought out ways that I could make amends." And to me, that just made it so clear that he chose to spend this really long sentence to help others. And I know that he'll help others when he's released. So I wanted to ask next, Erica, one of our amazing attorneys that we get to work with. So Governor Polis has the power to release people like Amber's dad, but he hasn't. So you're currently working on the lawsuit against Governor Polis and the Department of Corrections for their failure to safely bring our neighbors home. Can you talk about why it was necessary to file this lawsuit?
Sure. Governor Polis has responded to this crisis and used his emergency powers to protect the free citizens of Colorado during this pandemic because he knows how dangerous and deadly this virus is. But he really just has not done the same at all for the incarcerated citizens of Colorado. And while other governors around the country have used their executive powers and clemency powers to reduce this overcrowded and unnecessary prison population, Governor Polis has simply refused to do so. And, you know, people are trying, and families are trying, and lawyers are trying, and members of the community are trying, and Governor Polis needs to step up and do his job and show that people behind bars matter to him as well, and that they have a voice and place in society, and that they deserve protection too. And what's more is that there are thousands of medically vulnerable and older people in prison, and prisons disproportionately house substantially more people who are medically vulnerable, who are older, and also with little access to health care. And there are also a shocking number of people who are behind bars who are not a risk to the community and who have been model prisoners, like family members on this panel and that are listening in will tell you about. And, you know, no one is asking, and I'm not asking, the governor to release dangerous criminals into the world as he keeps claiming over and over again in his public statements, as Denise pointed out. But our state's, the reality is that our state's shameful history of using incarceration and punishment as the main tool to address chronic societal ills have left many people who are older and medically vulnerable behind bars, and people who are not a risk to this society, and people who have family members on the outside waiting to help them during this unprecedented global pandemic. And the governor needs to use his powers to release people and stop ducking this issue. And it was necessary to bring this lawsuit to both improve the conditions in the prisons and also try to help people get out. So.
Thank you so much, Erica. And I just wanted to give some background. So Governor Polis issued an executive order that expanded who could apply for special needs parole. And it was a way to respond to this public health emergency. And Will's dad, James, actually applied. But then Governor Polis let the executive order expire, and Will's dad, like so many medically vulnerable people, remains in prison with no way out. And so, Will, I wanted to ask you, why do you think the governor should do more to make sure that people like your dad, who pose no public safety risk, should be released during this pandemic?
Thanks, Alan, and thank you, ACLU, for all you guys are doing in this. You know, I think first and foremost, all human beings deserve some protection during this chaotic, crazy time. And so, you know, I feel that my dad deserves that same protection as everybody else, and as all human beings deserve. And to look at a guy who's given so much to DOC facilities and to communities all across the state through his artwork and through you know, inspiring and creating positivity inside of these prison walls through the contribution of his talents, I think that warrants a little extra special consideration. And through his sobriety that he's achieved, and through the internal transformation that he's also gone through during his sentence, I think that it's time for a guy who just wants to be a grandpa to his two little girls and restore a sense of unity in his family. It's time for him to come home and play that key role that we all really need and want him to fulfill. So I just also would like to note that the time spent in prison is not equivalent to the success that the person has when they're out of prison. In fact, it's actually the opposite. And once that rehabilitation has taken place, I feel that it's time for them to be reintroduced and fulfill that role in the communities and their families that they're meant to play.
Thank you so much, Will, for sharing about your dad. And I'm really sorry that you know, Governor Polis so far has urged all of us to do our part to try to fight COVID-19, but has been unable or unwilling to help people like you whose parents are in prison and are equally at risk. So what's really disturbing is that it's taken a public health crisis for us to even start to reverse some of the harms of mass incarceration. As many of you know, people across the country have mobilized to condemn police brutality. And I just want to point out that the entire criminal legal system is riddled with the same racism as policing. And that a mass incarceration has disproportionately hurt our communities of color. And one of the first things Amber talked to me about when we spoke was about the connection between racial justice and decarceration, and that we need to be mobilizing to release people from prison the same way we are around holding cops accountable. So Amber, can you talk a little bit about why you think decarceration is part of the need for racial justice in this country, and how has it impacted your family, that your dad's been in prison this whole time?
Yes, I can. In my eyes, the Black Lives Matter movement also includes decarceration and the issue of mass incarceration. Those two things, police brutality, mass incarceration, have a direct link in my eyes back to, lynching, Jim Crow, slavery. All of those things together really demonstrate a repeated example of how Black lives have been devalued in this country. That's the history of this country and the current day state of this country. And so and it impacts, mass incarceration impacts so many more of us than some of the issues that we've seen and the headlines that we've seen that have caused the protesting and cries out that we've heard in the Black Lives Matter movement. So for me, and for so many people that I know, mass incarceration impacts our everyday lives because it pulls our beloved family members out of our home and our everyday lives. As if it's not important to have a man like my father at home with his family and his grandchildren and contributing to his household financially and sharing his brilliant mind and all of his life experience with us at home every day. So the impact to our family it's devastating. I really can't even explain what it feels like to have a family member who's incarcerated. You feel very helpless, especially when there's someone like my dad who has an unfair sentence, 96 years for a nonviolent offense. And you can't shake a magic wand and bring him home. One of my greatest fears is to see my dad die in prison. It's a horrible feeling. It creates anxiety and depression. And it's really sad that my grandparents had to see him die in prison. They died fighting to get him home. And I have to take my children to see him, to visit him in prison. So it's just impacted multiple generations of our family. Families suffer when their loved ones are incarcerated. It's not a benefit. It doesn't make the world a better place. What would be better is for people, if they have to serve time, if they have to be punished or have a consequence for their actions, let's make them better and get them home to their families and help them be contributing stronger members of society and not dispose of them like they're not valued. And so for me, that's why decarceration is important, and it's the bigger picture of Black Lives Matter.
Amber, I feel so lucky to have learned from you over even the past few weeks since we started talking, because I really think with your dad, he could have done all the things that he achieved in prison, gotten sober, done all this work, but free in the community. and that, you know, a 96-year sentence, taking a man away from his family for his entire life helps no one. So thank you for being so vulnerable and talking about this over and over. I know you've done it a lot. So we've talked a lot about mass incarceration, and I wanted to talk about one of the drivers of mass incarceration, which is over-sentencing. So the National Research Council found that 222% of the growth in our prison populations in the last decade has been an increase in the amount of time that people spend incarcerated. So Gail has represented so many people facing these ridiculously long prison sentences. Gail, can you talk about the harms of over-sentencing? And can you talk about if any of your clients have received these disproportionately harsh sentences?
Sure. I have a couple clients I wanted to highlight today who are women, and they are both serving life without parole. This is Damika Rogers, my client, and here she is in the dog training program at Denver Women's Correctional Facility. Damika's in prison for a murder committed in her young 20s. But I think as a society, we need to recognize even people who have committed some violent crimes are capable of rehabilitation. And this woman has been in the incentive unit for more than a decade, which requires essentially perfect behavior in prison. She has given of herself to others. She has started a mentoring program called Women of Influence. She's very vulnerable to COVID. She has asthma. And again, she's done 15 years already. And I think you have another slide, Helen. One of the remarkable things about Damika is she starred as Ebenezer Scrooge in the Denver University Prison Arts Initiative production of A Christmas Carol in December. So this is her in role and character. And anyone who saw the play, who had the privilege of seeing this wonderful production, knows that Damika did a phenomenal job. It was an incredibly demanding role with so many lines to memorize, and she just turned in a stunning performance. She's totally rehabilitated now, and we are on track to spend hundreds of thousands of dollars as a state to continue to incarcerate her decade after decade after decade. She applied for clemency on her own and was denied. I'm representing her now, and we're seeking reconsideration. She's fully rehabilitated and ready to come back to society. And I think you have some slides of another client of mine. This is Christine Nye on the right with her granddaughter. Chris Nye, those of you who saw the play A Christmas Carol, you wouldn't recognize Chris's face, but she had a very important role in that. She was the scene director in charge of the sets and the technical director and kind of the artistic vision of the presentation. And again, she just worked so hard on that production and did a phenomenal job. Chris was 20 years old when, along with a couple other people, she committed a homicide. She was convicted of felony murder. And again, she has life without parole. She has done about 28 years in prison. And again, she has dedicated her time in prison to trying to help others. She informally mentors young women coming into the system all the time, just on her own volition, not for any pay or recognition, but just to try and help other young women and try and help them avoid the mistakes she made when she was younger. And I think you have another slide, Helen. Chris is very artistic, so she's, again, donated her time. When children come for holidays, Chris makes sure that the visiting room at Denver Women's Correctional Facility is a bright and happy place for them to spend time with their incarcerated mothers. So these are some of her Christmas decorations. She also has painted murals, as you can see. I think you have some other photos. This is what she did for Halloween. And you can just imagine what a difference this makes for children who are forced to visit their parents behind bars. Again, Chris is completely rehabilitated. The other two participants in the crime are now out of prison. And Chris applied for clemency, was denied. I'm representing her now, and we're hoping to obtain reconsideration.
Thank you, Gail. I think by working with you and so many other people, I've thought a lot more about why we have prisons. And I feel like I'm always told it was for public safety, and it's clearly not, because both Damika and Chris could be safely released. So I want to ask Hassan, what Gail is telling us is that millions of people in the US are facing these overly harsh sentences, And to me, it seems clear that we could release some of these people without it being a public safety risk. So can you share your thoughts on why it's the safe and the right thing to do to expand clemency and release more people from prison? And thank you again for joining us.
Yes, thanks for having me. First of all, I just want to shout out the ACLU for even putting something like this together, particularly focusing on the families that are impacted by those of us that find ourselves incarcerated. I'm kind of glad that my video is not working. To be honest with y'all, I've been messed up since the video first started, since this program first started, because I was shocked to see Mr. Martinez, someone that I know and spent a number of years in facilities with, to see him still incarcerated. That really that messed me up from the beginning of this. And so I want to, before I say anything further, just to the family members that are on this call, I can't possibly understand what you're feeling and what you've been going through with your loved one locked up any more than I can understand what my family went through while I spent 18 years incarcerated in Colorado. This is my 15th year home, and I've been blessed to work with a number of people who have been given an opportunity to come back to community. I'm gonna just say off the top, I have a staff currently of 26 people, 13 of whom are formerly incarcerated people. So at Second Chance Center, we have about 160 years of cumulative incarceration time on staff. This is a picture of my Deputy Executive Director, Sean Taylor, who caught a life sentence for a gang-related homicide at the age of 17. He did 22 years in Colorado prisons, and his sentence was commuted by Governor Ritter 9 years ago. And together we built this organization really in an effort to try to end the cycle of incarceration and generational incarceration as much as that's at all possible. So just looking at the three of us, Sean, myself, and Adam Abdullah, who's our mentoring coordinator, he did 33 years in 3 months straight in the feds. So, you know, we three represent folks that most would think, looking at the black and white, could not function in society without perpetrating crimes against our fellow citizens. That's not been the case with either of us or anyone on our staff. We've had a recidivism rate of under 10% for the last 7 years. It was below 5% ending this cycle June 30th. I've never, in 8.5 years of working with Second Chance Center, I've never had a client come through in an advanced age that we ever had an issue with as far as them returning to incarceration. Our biggest challenge over the last several years has been the flow of older and older persons returning to community. And it seems almost as if they're kept so long that they become too much of a burden on the state to keep incarcerated. And then they're let out into community, and those of us who are dedicated to supporting them are left with the challenge of trying to find a way to house them. And most are not even able to go to work at that stage in their life. So, I'm one who firmly believes that at some point, whether someone deserved to go to prison or not, at some point it stops serving a purpose. And for many of the people that we're talking about now, it's clear that if they were allowed to come home, particularly with those of us that are out here waiting, their family members and those of us in community that are waiting to support them, that understand what's needed to support them, to me, it's almost a no-brainer that these folks would do well coming back to community. There were several things that I wanted to say. I'm kind of an emotional person, not generally so, but when it's issues that touch my heart like this, I'm looking at those pictures of children and grandchildren. I've been blessed since I came home to actually be a part of 2 of my grandsons' lives, where I watched my children grow up in the penitentiary. And, that's a lot of damage done to families that those of us coming back still have a lot of work to do. We might be continuing to work on ourselves, but there's a lot of work that we have to do with the families that we've damaged. My daughter in particular, I saw her take her first steps when I was in the county jail. When I came home, she was in college. And we have a really good relationship now, but it took us 12 years of working at it. That's how much damage was done in my absence. And it's the kind of thing, even when I think about it now, it pains me to even think about it. So we're out here in the community to support the families that they're returning to, and even those who don't have families to return to. We're here for them. We're committed to this work. We're dedicated to this work. And the governor is very much aware of the fact that there are community entities out here that have had really tremendous success with helping folks transition successfully after incarceration. I don't know what we can do other than what the ACLU is attempting with this lawsuit to bring pressure to bear. But one I want to speak to, if I could, just the labeling of dangerous criminals. You know, if someone looked at my black and white, for instance, they looked at my jacket right now from the 80s, all right? I wouldn't be invited to anyone's home, all right? But that person doesn't exist any longer. And it took a while, even after my release, and a lot of work and the blessing of opportunities that people afforded me to actually establish that truth. And still to this day, I find that sometimes people refer to that time in a life that's no longer in existence to dictate how they interact with me or approach me. And this is the same thing that our folks are dealing with every single day. And the thing about someone being released, I'm thinking about the fact that it's not just those who are currently incarcerated inmates that are at risk. You know, a large segment of the population might be able somewhere in their mind or in their heart to dismiss those people as being worthy of consideration. But we have staff that are in and out of these facilities. I just like to point out that nobody got coronavirus in any Colorado penitentiary by traveling to China or Europe. That was introduced, most likely, by staff members. But we have these same staff members coming in and out of facilities, returning to their homes, returning to their communities. This is an issue that everyone is connected to, and everyone should be concerned about how it's being dealt with. And that's what I'm hoping will come out of this initiative to try to bring more light to this issue and get some more action. So however we can help, we're here to do that. But I just want to thank you all for bringing the families into this, because for 18 years, my wife screamed in silence out here in community, trying to find a way to get me home and to help me survive while I was in there. And I want to see the families' voices amplified and in defense of their loved ones. And that's why I'm here today.
Well, Hassan, it's hard to speak after that, but thank you for being so honest, and it makes me so sad that you knew Anthony and that he's still in prison. So it is 5 o'clock. So we are, we have almost 200 people still tuning in. So I'm going to keep asking questions of our panelists, but because I am learning so much from you, and I think that it's just so powerful to remember, despite how I think public officials sometimes talk about people behind bars, that they're fathers and mothers and brothers and sisters and grandparents, and that they deserve as much a right to live free of COVID as the rest of the community. So my next question is to Sandy, because you were one of the first people that I spoke to, and I just wanted to bring up Gary's photo again. It's very clear from all this that we could safely bring home people like Gary. Sandy, can you just talk to us about what it would mean to have your husband home?
if Gary came home, he'd get the proper medical attention that he needs for everything that's wrong with his respiratory, his legs, his back, his shoulder, and it just I cannot go in a hospital and schedule have my intestines removed because I have no other family but my husband, and I'm scared to go into surgery and go under and maybe not wake up and not see him for one last time. I'm so sick. I've written the governor. I've called. They don't call you back. They don't answer you. They don't care what's happening to anyone that's in prison. And I'm paying for it out here because I can't move on. I'm sorry. And you have to pay for the phone calls and they're expensive. I'm on disability now. I barely make enough for my bills. And I'm alone. I just want to go home. I want to go so bad so that my life can go on. I mean, this virus woke him up and he said, I never realized how bad and the things I've done that hurt you. And to lose you and not see you one last time or be with you is killing him. And sometimes I don't even get up. I lay there in bed. My friend's here with me. And they would tell you, he calls and tells me to suck it up, get up and go to your treatment. Don't miss it. I'll be home soon. And if it wasn't for that call and the letters, I won't get up. I won't go. I still have bad days because I just want to give up. He's my other whole, and I'm his. 20, our kids were 22 years together. My mom's passed away. My family's in Pittsburgh. His mother passed away. And it's just, we have each other. And his sister is 74 and she's not all there. And he's the type of person that he would give you your last dollar in his pocket for something if you needed it. If you need food or something, he'll cook me breakfast. If somebody he knows down the street it doesn't have or they're suffering, he will take food out of our freezer and take it to them to make sure they have what they need. And he's just that type of person. He will give you his all. I've been in the car with him and we go to the gas station and he's seen a mother and a child there. And he said to me, give me what you have in your pocket. I'm like, I only have this much. He said, don't worry about it. God will give it back to us. And gave him the last of our money. And that's how he is.
He's always looked out for the younger generation as well.
He's so
a very good mentor. And he slipped, But everybody deserves another chance. And right now they're running out of chances, running out of time.
He has
Sandy, thank you so much for talking about this. And I know the first time we spoke, it was so hard because you're battling cancer, but then also devoting all your energy to trying to get him free because you're worried about him. And to me, it is just the mark of a fundamentally broken system that we would incarcerate a grandfather for drug possession during a pandemic.
I know. And with him on it, he's on an air machine in there. He has a tank. And I read last night, California prison, I have it right here. California prison has, with the inmates and staff, is 1,950 people infected. That's the inmates and the staff. 915 staff members have the virus that are in the prisons. Out of them, none of them have died. They got to go to the hospital. They had the machines. They had the medicine. None have died. But 51 inmates have died in the California prison system of the virus because they do not have the medical needs or facilities to take care of them. They need to have the same rights that we do out here. And I don't think that they're going to kill them. They're going to kill them. And my
Sandy, thank you again for sharing this. And this is actually, it goes really well to the next question that I wanted to ask Erica. So Erica, Sandy was talking about how it's not safe in prisons. Can you talk about why people in prison are so much more at risk to COVID and, you know, what's happening in Colorado's prisons?
Sure. You know, jails and prisons are just widely known to be epicenters of COVID-19, and huge outbreaks, both in prison and their surrounding communities, are clustered in correctional settings. And it's really not that hard to understand why, given what we know about the virus. I mean, and prison conditions. I mean, people in prison sleep, work, eat, live all day, every day in extremely close quarters in large congregate populations. And in Colorado's overcrowded and dense populated prisons, physical distancing, which we know is the best way to produce the spread, is all but impossible. And you know, they have cellmates that can't sleep alone, they can't eat alone, they can't do anything alone, they can't shower alone, they can't use the bathroom alone. I mean, think about having to wait in line to use a telephone where you can't socially distance, and where the phones aren't cleaned enough, and where some people aren't wearing masks, and where all surfaces are communal. I mean, people also move through the units, sometimes positive and negative, to do jobs at prison, and staff members bring it in, and then it spreads like wildfire. Bad analogy right now, I guess, but and then you add poor ventilation, and you can understand the compounding of the problem. And as a result, COVID was and is spreading. Sterling, a very good example. I mean, this thing is far from over in prisons. We're hearing about new people and new outbreaks in Sterling that are testing positive right now, and prisoners are unable to test themselves, and they can't do what we do. So you have this horrible combination of an extremely contagious virus and a virus that thrives in exactly this type of setting, and then you have a large number of older, medically vulnerable people, and the outcomes are predictable. And the reality is, the only way, I mean, you know, we're in a lawsuit to help protect, you know, make conditions better, but what DOC knows and what the governor knows, that the real way to protect people is to let people out. And again, the governor knows this, but you know, we're not, thankfully, in a state where the people in charge don't believe the virus is serious, but instead, unfortunately, we are in a state where incarcerated people are being ignored by the people charged with the responsibility and power to protect them. And as you can hear from the families, it's heartbreaking.
I know, I'm still, every time I talk to Sandy, it just makes me just really angry. And I just want to talk about dehumanization for a moment, because I think that is in a lot of ways the goals of prison, giving people numbers, having everyone dressed the same. And then on top of that, having public officials like the governor keep calling people dangerous criminals. And what talking to people like our family members and like Will is hearing about that everyone has the same fears and worries for their loved one and wants their loved one to stay safe. And that's all everyone's asking for. So Will, I hope that you could just share a little bit more about your dad and, you know, why he deserves the same protection from COVID as everyone else, which in this case means release from unsafe conditions in prison. And I wanted to bring up some of the amazing art that your dad has done.
Yeah, thanks again. It's really great to see that artwork. You know, he's been busy throughout the 7 years that he's been inside, giving his talents and his hard work to brighten up these prison walls and to bring some inspiration and creativity and a better space for the not only himself and through the productivity there, but for also the other people who are incarcerated inside, and also for the staff that work there, to make a much more pleasant, enjoyable place to live. And he's also contributed and made examples of how he can be an influence in communities, not just inside of the prisons, but also outside of the prisons by contributing his talents and hard work to communities like Canyon City, and leaving his mark on the streets of Main Street, Canyon City, with different art installations. And so I think he's done a good job of showing how that these people, and like my dad, can be an asset to communities, be an asset to their families. And he's been fortunate enough to be able to do that inside of prison. So I think that it's obvious that if he were released, that just goes to show what an impact he and people like him could have on their families and their communities. And yeah, I think just fulfilling that role in their families would bring a lot of balance and health and safety to everyone. I like Hassan's point about the staff being affected in this as well, and how that goes out and affects the greater communities as well. So when we think about safety for everyone, we really do need to start thinking about these people who are incarcerated first.
Thank you, Will. And I think it's so true. Do you mind just turning on mute? I think there's feedback coming through. Oh, thank you. It's true that COVID's really forcing us to realize what a community we are and how we're all bound together, because COVID is spreading in and out of prisons. And the only way to stop the community spread of COVID is to stop COVID in our prisons. So I wanted to go back to Hassan, who, might make me cry again. I wanted to talk, you mentioned about how people who are released, especially if they're older, have trouble accessing healthcare and housing. And I worry sometimes, and I've heard this from others, that we are forced to decide between keeping people behind bars and taking them away from their families for no reason, or releasing people and then providing them with no support after spending decades incarcerated. And we're so lucky in Colorado to have the Second Chance Center as a leader in helping bringing our neighbors safely home. So I wanted to ask you, what do you think that the legislature could do to make it easier for folks when they're released? How can we support our neighbors as we're bringing them home?
Well, that's a great question, and thank you for that. Second Chance Center partners with a number of organizations in an effort to make corrections and adjustments in the sentencing structure here in Colorado. Colorado Criminal Justice Reform Coalition is the head of the spear when it comes to criminal justice reform, and have been for many, many years. And so we have work ongoing to try to address some of the inequities in sentencing, which is not new to folks who are familiar with this system. When we start talking about the disproportionate impact on communities of color, it starts even before sentencing, because it starts with policing. And right now I'm sitting here with a lot of things going through my mind. And in particular, the fear of someone coming out of prison and recommitting a crime against the community, it's a reality. And it's not really if it happens, it's more like when it happens, if we're being honest. But it's such a rarity for those who have spent a lot of time in prison. It's a rarity for those who have advanced to older ages. It's really very, very rare. And the same folks who want to say, when a police officer chooses to rest on a man's neck for 8 minutes and 46 seconds until he's dead, or shoots a man 7 times in the back in front of his children when he's unarmed, Black men I'm talking about right now, there's cries to to not rush to judgment and to give consideration to the fact that these are just some bad apples, that the police force is not really racially motivated to police the way they do. Well, I'm saying the same kind of thing, is that one person coming out and doing something horrific should not be the impetus for deciding whether another person gets a chance at life. And so I think what we can do in the legislature, one, is to continue to do some work around restructuring sentencing. This kind of thing is ongoing, and we hope that the next legislature is going to produce some things that will impact this this part of the problem. We've been a party to a number of pieces of legislation passed into law since our existence, and we've been pretty proud to have had that kind of impact on the process. And really it's been because so many of the folks that we serve and that have come out have actually got engaged in the process and have come and testified at the Capitol for different bills and have established themselves. Let me just point something out to the people who might still be listening. I said earlier that we had 160 years of cumulative incarceration time on staff. So for us to even have an opportunity to work in the arena that we work in is a blessing. And it's not something that came easily. We had to fight for the opportunity to work in this arena, formerly incarcerated persons. But as a result of getting that opportunity, we've been able to prove and establish with data that there's a different way of going about this thing. And it starts with recognizing the worth and the value of every single life and respecting that and embracing the possibility for this person. That's our approach to everybody who walks in the door at Second Chance Center. And when we say that that whole provider recipient power dynamic that usually is in play when someone's coming for assistance, we reject that at Second Chance Center. We choose instead to partner with our folks. And we say the better they do, the better we're going to be able to do. This is the absolute truth. The proof of it is just last year, June of 19, Governor Polis in his first year signed 9 pieces of legislation into law, criminal justice reform legislation, and he came to Second Chance Center to do it. So that's recognition right there that people are redeemable and that there's value in folks when they come out if they're given an opportunity and if they're given support. You know, we call what we do around Second Chance Center role model possibilities for our folks as well, but we think that we're examples for the community to look at, that people actually can make better lives for themselves. They can change the way they think and improve on the feelings that have plagued them perhaps for decades, and that they can find a way to navigate the challenges that everybody faces. I'm a hopeful person. I'm a hope fiend after years of being a dope fiend. Actually, I'm still a dope fiend. I just haven't used for 31 years. But my hope is that the collective experience of COVID, you know, we have people in America who historically are not used to being uncomfortable. And COVID has made folks experience isolation, separation, the anxiety, the worry about the next meal or the security of their job or their housing. Well, these kinds of anxieties are what people incarcerated live with every day. And to throw all of that, and then now this disease that there's no way for them to avoid in prison. I can't even imagine. I just thank God that I'm not in there right now and thinking about how my family would be out here suffering, worrying about whether they're going to get this call about me testing positive or actually turning up dead. So I think the legislature is in a good place going forward. Representative Leslie Harrod, in particular, she's been. Oh, you're looking at this picture. Can I say something about this picture? This picture, this picture is a bunch of my staff members, and we all miss the prom because we were caught up in the life or we were in the penitentiary. And this was a fundraiser, the first fundraiser done for Second Chance Center. And it was at a beautiful apartment on the 25th floor of a building downtown that someone let us use. And we took advantage of it to wear tuxedos and gowns, and so we all miss prom. And I'm thinking about that now because, being incarcerated is about missing and missing out. And, when I saw all those pictures of grandchildren and great-grandchildren, it really impacted me. And I hope out of the couple of hundred people that were on this call that they share some of that imagery, because when someone goes to prison, their families go as well. And if, our community, our nation is not going to get healthy, it's not going to get well if we're leaving anyone out of the equation. Are we still on?
Yeah, we are. I'm wondering maybe if Helen's video has frozen.
Yes, it did.
Hopefully she'll be back with us in a second.
And I don't know if I even answered Helen's question. My mind is so disrupted right now, and it has been for the last hour I've spent with you all. So forgive me, please, if I didn't really answer the question directly.
No, I think your answers have been marvelous. I'm sure Helen will be back with us in just a second when she can get back on. So we'll just give it a second here. Maybe Denise could come on and join us. And this is just some of the stories we've heard here today have been just absolutely heartbreaking and really underscored the need for what we're doing tomorrow. And we will have an email going out later tonight. And then we'll send information to everybody who has been participating in this webinar today. So you can all take part in our day of action tomorrow, but we're really, really hoping to see some change with the governor.
I don't know, Delana, do you think it's appropriate at this point to turn to some of the questions?
Yeah, let's do that. Do you want me to read them for you? Or have you been reading through them?
Some of them might actually go directly to the panelists, so let's see. There was a question here.
Yeah. Gail, do you want to join us real quick?
Sure. I know that one of the things Helen was hoping we could talk about today is, dream policy. If we could go to the legislature now and achieve criminal justice reform, what would it look like? And I know someone in the chat said, essentially we need to be doing criminal justice reform at warp speed in the age of COVID. And I think that that's absolutely right. Hassan spoke about the Colorado Criminal Justice Reform Coalition, which has done amazing work, and Colorado has made great strides in the last few years. But let's be clear, we can do so much better. And the over-incarceration is massive. And I just want to put some numbers on this for people. Again, focusing on women for a moment, women prisoners. The United States has the highest rate of incarceration of women in the world. And that's 133 per 100,000 members of the population. Colorado exceeds that. We have 149 per 100,000. And if you compare that to other countries, it's insanely out of control. Australia, 28. Canada, 13. Germany, 9. We can do better. We can halve our incarceration rate. So I think there are lots of specific policy reforms we could do. We could reform the habitual offender law that Denise was talking about in the video. We could eliminate life without parole and make sure that there's a second chance safety valve for people after they've served a certain amount of time. We could eliminate mandatory minimums across the board, and all of those are incredibly important. But if you ask me my dream policy, I would say let's have the legislature mandate that we significantly lower the incarceration rate. And then the policymakers and all the people in power will have to figure out how to do that in a way that does focus on public safety. Because what we have right now is we are spending close to $1 billion a year on our state prison systems, and that is a policy choice. And if you think, I don't believe that that policy choice is making us safer. And I think, for example, if we could take a small percentage of those funds that we spend to incarcerate people in these prisons with all the problems we've talked about today, a small percentage of that, and shift it to community organizations like the Second Chance Center that is going to support people with love and assistance and community and help, I think that will improve public safety.
Gail, I couldn't agree more. On one hand, we have a pretty high recidivism rate, and it seems as if we could bring in more Hassan Latif Second Chance Centers, we'd be doing ourselves a lot of good, in addition to all the other issues that you raised. So I really, really appreciate it. Those were all of the questions, honestly, that we had. And gosh, the panelists did fantastic and amazing job. I don't even know how to thank you all for all of this work. I know we had said, Delana, that we would give some time for other questions, but I mean, there are some in the, am I looking at the chat or in the Q&A box? Where should I go?
I'm looking in the Q&A box. There's one that I think is interesting about what are some of the barriers of receiving healthcare after leaving the prison system. So I don't know if any of the panelists can answer that for us.
Yeah, that either seems like maybe Hassan or Gail, it would seem like, or maybe even Erica. Whoever wants to take a bite at that one, that'd be great. Don't all jump at once.
Oh, here comes Hassan.
Excuse me. Can you just repeat the question, please? I'm sorry.
It's a barrier to healthcare, Hassan. What barriers are there to good healthcare once you leave, once you're on this side of the wall?
Well, I'll tell you one of them that we've been dealing with quite frequently in the last several weeks since folks have been being released over the course of this summer through the crisis is people having difficulty getting ID. The Department of Corrections has done a lot over the last several years to have people released with identification when they come out, but still there's far too many that come where we're struggling to get people birth certificates and social security cards before they can get identification and be able to return to work. Likewise, without identification, it's hard to access healthcare out here. We've been able to do some things to eliminate that barrier for some folks, but it's still a challenge. When you talk about some folks who might be eligible for Medicare, but others, have to find work that eventually provides healthcare benefits. And now, particularly with COVID striking, we're more challenged than ever to find good life supporting employment for our folks, because now we're competing for the jobs that general population out here in community weren't trying to get. Now everyone's in need of another employment opportunity. So our folks are competing with people who've never been incarcerated. And that there's already the challenge of getting an opportunity to work and prove yourself. And now it's an easier choice for employers. You have a person here with a criminal record, and you have a person who's trying to support their family and lost their job due to COVID. So what choice do you make? So it's all connected,
Very,
so,
very
when we
good.
talk about healthcare, one of the things I just want to add is that we believe that successful transition after incarceration is a matter of community health, and that's across the board. And those Second Chance Center, when we started, like I told you, it really got started and moving along with 3 of us with 75 years of incarceration time. And we weren't viewed at that time as being a part of the solution to the problem. But thankfully, over these last 7 years, we have established ourselves as being a real integral part of the community safety equation. And here's the thing. If we do our jobs really well, it's not the kind of thing we're ever going to put in a quarterly report or in a grant narrative, because it'll just be in horrible things that never happen, and people that are never victimized, and families that are never destroyed and broken. And so I think there's only one that keeps track of those kind of things, and that's God. So we're satisfied with Him keeping track of it.
That's great, Hassan. I guess you're right on that one last point. There are two things one question that I want to ask, because I think maybe it's the elephant in the room in some ways, is why does it take so long to get clemency? What's the process? Seems like there are a lot of folks on the panel that might be able to answer that, but I also wanted Amber in particular, if you would look at the chat, there is actually somebody asking specifically about Ron Johnston and how we can help him. And you may have answered that in there by saying that his petition has been on the governor's desk since December 2018. And of course, one of the things I'll give a little preview and give you an announcement, but there will be a similar video that we plan to put out tomorrow along the lines of the Anthony Martinez video that you saw early on. And it will focus on Mr. Johnson's situation. So if you can share that video out and do part of the action, that in of itself would be super helpful. So let me ask the question on the clemency process, why it takes so long. It seems like Hassan, Erica, Gail, either one of you maybe could talk about the process, and then again, why so long, and why are individuals like an Anthony Martinez, 84 years old, as sick as he is, how come he's not prioritized? Just kind of give some talk on that would be super helpful. Gail, you have filed a lot of clemency petitions. Why don't I pick on you?
Yeah, okay.
Sure.
Or Erica, yeah, whomever.
I can speak, and I'm happy to pass the baton to Erica too. But so there are no rules that govern the clemency process for the governor in terms of timing. So it's very discretionary. I saw someone in the chat saying that something had been sitting on the desk since 2018. I had a client who received clemency in December of last year after I'd represented him for about a year or so. Previously, before he had a lawyer, he had a petition pending for 5 years. He's done 30 years in prison. He now works at the Second Chance Center. I believe he's actually innocent of the crime he was convicted of. He absolutely did not need to be in prison those last 6 years. But the process is unfortunately slow. I think it has improved recently. The governor did reconstitute the Executive Clemency Advisory Board. Hassan Latif is on the board now, which is fantastic, along with some other new folks. So I think it's better than it used to be. But for sure, I think that there is a large number of applications that are pending for quite a while. And, I think that's really an issue for the governor and his legal staff to address.
Yeah, I mean, that's really kind of the point of the Day of Action, right? Is something that I mentioned early on, was this really is in the sole authority of the governor to grant clemency. And so with essentially the strike of a pen, right? I mean, he could do it if maybe motivated to do so.
Absolutely, and there are creative things that governors in other states have done that he could do. For example, he could grant clemency as a group. Instead of doing the time-consuming individual petitions, he could look at, everyone over 80 years old and maybe some other criteria, or everyone over 70, or everyone over 60, or everyone over 60 who has a significant health problem that puts them at risk of COVID. There are lots of ways to look at the problem and try to
and I honestly think some people are working along those lines of, here are the different cuts of the pie, like you're saying, and have that happen. Erica, real quick, did you have anything to offer? Or, I mean, of course you have something to offer, excuse me, anything to add to what Gail just said?
Yeah, I mean, Gail's done so many of these, and I mean, just that it's completely within the governor's discretion, and also there's not a lot of transparency at all in the process. I did my first clemency petition, And it seems as if you get notified if they get denied or approved, but otherwise it's just sitting on desks and there's no transparency of even what, the clemency board might have recommended, even if it's unanimous. And governors in other states have done what Gail said about kind of picking groups of, people that have served crimes that are now, that were once felonies and are now misdemeanors. I mean, it would seem to me that, Governor Polis ran on a platform of legalizing marijuana. It's an essential service to many people in this, to all free people in the state. And it seems that people that are actually serving time for marijuana possessions would be out, or, it seems like there are categories of people you could grant clemency to. And if you just made it a priority, I mean, we've seen in Oregon, they've done that. In New Mexico, they did that. In Pennsylvania, they did that. In Michigan, in New Jersey, they've done things and it just seems to be sitting on his desk and not a priority. So I hope that will change sometime soon.
Erica, this is another one for you, I think. There's a question that also asks when are family visits going to be resumed in the Colorado prisons? And I don't know the status of that. It might be worth you. Are family visits completely cut off in all of the prisons or only some, or what's the status?
I believe so. I mean, I'm not sure what's going on virtually, but I believe so. I mean, a lot of Sterling's in phase 3 lockdown. They've been in that way for months. And, I don't know when family visits will be resumed. I think it's going to be dependent on how many positives are in a certain DOC. I think it's going to be dependent on that. That hasn't been as much of a focus of the lawsuit. As opposed to the conditions that are going on, I wish I knew the answer to that. I really do.
So another thing that's just kind of a wait and see.
Yeah, 2020.
I think we've gone through most of the questions.
And thank you, Denise, so much. I just wanted to address the fact that I disappeared. I lost Wi-Fi, which is my worst nightmare realized. But thank you everyone for joining the webinar. And if there aren't more questions for any of our panelists, I hope that this was inspiring for all of you. I know that Gail's last question was on what we can do the next legislative session. So I hope you'll join us in working to build a more just system that actually supports families and works for everyone. And if you RSVP'd for this webinar, you will get an email with information on how to call, email, and contact the governor on social media. And please make sure to follow the ACLU, follow our Twitter, our Facebook, our Instagram. Amber, who was one of our amazing panelists, will be sharing a video we worked on with PNC tomorrow. So if you follow us on social media, you'll be able to see Ronald's video, which is an extremely powerful call to release vulnerable incarcerated people. So please make sure to follow us, and you'll see that video and you'll get the information on contacting the governor. And if there aren't any other questions, thank you all for joining.
The only other thing I'll add, Helen, is that both Gail and Hassan did put their email addresses in the chat. If folks are interested and need to get more info on any of that, please reach out to them. And again, let's really fire up all social media, emails, phone calls tomorrow for our day of action. Thank you for everybody, and have a good evening.
We'll make sure to share the information for the panelists who were comfortable releasing that. All right, and we can push the governor to release people tomorrow. So that was a perfect last question. Thank you, everyone. Have a good evening.